Go.
So we had the chapter on diabetes in the China study, and we took a look at some of Colin Campbell's claims, which were that the consumption of meat and high-fat diets is a big factor in promoting insulin resistance. Lifestyle changes like diet and exercise, such as a diet high in fiber and high in carbohydrates, can help decrease this risk.
Okay, who is T. Colin Campbell? He has been in nutrition research for over 40 years. He has done over 300 research papers, and he is the founder of the T. Colin Campbell Foundation. As you can see, these are all of his background information. He has a PhD. He worked at MIT, Virginia Tech, and he is currently at Cornell.
So the first study that we took a look at was a large longitudinal prospective cohort study of over 20,000 Caucasian white or Caucasian Seventh-day Adventists, vegetarians and non-vegetarians, comparing the two, ages 30 to 89, and it was a study for over 21 years, this group. And vegetarians were defined as those who ate meat or poultry less than 1 day a week, but regularly consumed dairy and eggs. In 1981, at the end of the study, a medical clerk reviewed all their death certificates to identify those who had diabetes as a contributing factor to their death. The results determined that diabetes was associated with meat consumption among men, but not in women, although this was not the case at the beginning of the study, where both men and women had the same association, and there's not really a reasoning for this in the article. Some of the things to consider or limitations was that blinding was not used. Diabetes was self-reported, so a medical professional did not officially diagnose this, and it was not always present on the death certificate whether they had diabetes. Changes in meat consumption may have been a factor. Non-vegetarians decreased their meat consumption, and also genetics and family history. Colin Campbell made a claim in the China study that vegetarians had 50% less prevalence of diabetes compared to non-vegetarians, but when we looked at the actual data, that was not true, and combined males and females, they only had about 17% less prevalence of diabetes among the vegetarians compared to the non-vegetarians. The next study was a longitudinal case control study of over 1,200 Hispanics and non-Hispanic whites. They had no prior history of diabetes. They were compared to 1,076 control group who were confirmed normal glucose tolerance. Their fasting blood glucose was taken, 24 dietary recalls, and interviews were conducted, among many other tests. The results were that glucose levels were affected by high-fat diets negatively, but protein and different types of carbohydrates had no effect on blood glucose. And vigorous exercise was found to counteract the effect of a high-fat diet. Some of the limitations were that underreporting and high inter-variability of a 24-hour dietary recall could have occurred. It was a small group of diabetics tested. Family history could have been a factor, and possible false positive diagnoses could have been a factor. One of the things that I noticed while examining the research was that fat, carbohydrate, and protein intake among the test subjects was not very different significantly. It was only about a few grams difference.
Okay, I did a study on the response of non-insulin dependent diabetic patients to an intensive program of diet and exercise. This involved 60 patients at the Pritikin Longevity Center in a 26-day program. 40 of the patients were men and 20 were women. 40 of them were on medications and 20 were not on medications. The procedure involved them being on an intensive program of diet and exercise. They had a high complex carbohydrate, high fiber, low fat diet. They also engaged in an exercise program of walking and aerobics classes. They had individual counseling, and they attended daily lectures for healthier lifestyles. They found that an effective diet and exercise program may significantly reduce the risk of cardiovascular disease in non-insulin dependent diabetes mellitus patients, and diet can also influence hyperglycemia levels and significantly lower serum lipids. This is a research criteria that we found summed up. Some of the limitations of the study were that it took place over a short time period and small group size, and there were no specifics as to how the patients were divided into the groups. The positive aspects were that it adds to current research, and there are many aspects contributing to NIDDM. How does this relate to the China study? Campbell is relating this research to reinforce his belief in the significant reduction of previously prescribed diabetes medications due to a low-fat, plant-based diet and exercise program. In the book, he states that the low-fat, plant-based diet can significantly reduce these levels, but if you look closer, the patients in the study have non-fat milk and small amounts of fish or fowl served weekly, which means that they're not strictly vegetarians. And he also combined the 21 patients in the medications that they were saying. It's not a huge significant factor, but it is a factor. The next study was the hypolipidemic effects of high carbohydrate, high fiber diets. The study participants of this group were 24 male patients in a metabolic ward, ages 32 to 70. They were separated into two groups. One was of lean men and one was of larger to obese men. They were each prescribed a diet. Group 1 had a controlled diet followed by a high carbohydrate, high fiber diet. Group 2 had a controlled diet followed by a high carbohydrate, high fiber diet, consecutively followed by a high carbohydrate, low fiber diet. And they found that diets high in carbohydrates and fiber lower insulin doses and lower plasma glucose values, as well as cholesterol levels. And this just sums up the criteria in a slide. And some of the positives and the negatives. The positives were that the procedures were detailed and the results section was also highly detailed. The limitations were there was a small group, only males in a metabolic ward. They had varied length of diets and varied dietary patterns. How does this study relate to the China study? It's difficult to find relevant information based off of the documented research because he's relating the idea that diet alone may be a major factor in lowering cholesterol levels in a short period of time. It could be validated, but there are questions relating it back to the research. The next article was the increased incidence of non-insulin dependent diabetes mellitus among Japanese school children correlates with an increased intake of animal fat and protein. This took place in Tokyo, Japan, with 221,000 to 386,000 Japanese school children from 1974 to 1999. It was noting the secular trends of childhood NIDDM. The procedure, they did lab tests to determine if the children had diabetes, and they also noted the changing dietary habits of the Japanese school children in relation to obesity and diabetes. They found that there was an increase in diabetes due to an increase in the amounts of animal protein and fat that these children were eating. They also related this back to reports from other studies. Certain amino acids can lead to increases in insulin release, such as those three listed up there, if combined with meat intake. And the saturated fatty acids induce insulin resistance, which leads to an increase in insulin response to oral glucose tolerance. And that's also the research criteria summed up. And the positives and negatives. The positives were that it's a large sample size longitudinal study, and it's adding to existing studies already published. The limitations are very numerous, unfortunately. It's limited to Japanese school children, and the statistical tests there was a lack of clarification, and there was a lack of detailed descriptions of the procedures and the methods used. How does this relate? Campbell's using the information from the study to add to his findings about the plant-based diets contributing to the increased rates of diabetes. And then we summed up the eigenfactor scores. The article that I did with the Japanese school children actually scored the lowest at 41%, but the other ones scored above a 94 to a 98%.
So what we ended up learning from all this information is that high-fat diets and contributed to the development of diabetes. High complex carbohydrate diets and high fiber help prevent it. High protein animal-based diet was inconclusive whether that contributed to the disease, and more studies need to be done. As well as Campbell often elaborated on his studies to enhance, to fit into his theory. Many of the studies were outdated but still relevant, and but we did find that most of the studies were valid, with the exception of Campbell's elaborations.